Yes, we are going to start with this PACES, change in the format since 2023 and the last diet. So there are number of stations are same, but their format has been entirely changed. Before, there was short history and long clinical consultation of only history taking in the session two. But they have changed now. We need to perform two long clinical consultations, uh, including the history and the short examination and sensible differential diagnosis we have to give them, and then management plan, then so on, the investigations. So station one, it's a combination of two stations in a single room. It is communication and the respiratory system. For each, you have 10 minutes. Remember one thing, there is a no gap, there is no time allowed in between these two stations. When you will finish the communications, so you immediately move to the next station. So there is no reflection time. You will go to the pulmonology and you need to perform that 6 minutes examination and 4 minutes with the viva with the examiners. Then next station is station two. Station two is a long clinical consultation. Again, it's a 15 minutes with the patient and 5 minutes with the examiners. In between these two, station one and station two, there is a 5 minutes gap. You take a deep breath and sit outside. This is the only time which you need to utilize wisely. These 5 minutes from station, moving from station one to two, because you will build up your whole differential diagnosis, your whole plan of clinical discussion in these 5 minutes. But remember one thing, these are not 5 minutes. Consider 4 minutes or 3 minutes, because once the bell is ringing, so you are getting coming out of that room and you're going to the next station. So it takes time. So remove your 1 minute. So remaining 4 minutes, 4 minutes you need to read thoroughly this scenario. Scenarios sometimes are they're short, they're very long. So you need to be very quick. Few things need to do over here. Take a white paper provided by the RCP and lead pencil. Just write down the name of the patient, presenting complaint, and write down the settings, in which settings you are going to deal with this patient. Patient age and patient name is very important. You need to remember. If you forget, it's not a big deal. You can ask within during your consultation. May I confirm your name and age, please? So this is a tricky area. Which, if you forget the name, don't be shaky. Just ask the name and age from the surrogate. You will have 15 minutes with the patient, surrogate, I mean, and 5 minutes with the examiner, viva. We will discuss in detail how to utilize these 15 minutes, because its time is very short and you have a very long list of tasks you need to perform during these 15 minutes. Coming to the next station is under station three. Station three is a combination of again two short sessions. First is a cardiology, then immediately after bell you need to move to neurology. So they will be in the same room again. There is no gap in between that. You cannot leave the room after cardiology short case. You need to move immediately to the neurology. So after that, again 5 minutes you will be provided. Then again you will have a scenario of communication. This is a big scenario, very big scenario. It's not like that we are practicing in usual life, that we are giving some, short 3 4 lines and we are performing and practicing. It's a quite big scenario. Almost it takes 1 2 to 3 minutes to understand what's going on with this surrogate, or with what's the agenda in this, what's your task. So we need to be very sharp and very wise what information you need to take during your reading process, how to utilize these 4 minutes. We will discuss on that today. And the last, again, the clinical consultation, the second clinical consultation, again 5 minutes. Consider it 4 minutes. And again the same. You need to prepare your card. Use these 5 minutes or 4 minutes. Okay. So this will help you a lot in real exam. So the biggest difficulties what we are with candidates are facing in these PACES exam is a time management. We have discussed many times with the candidates. So it's a exam of not a knowledge, it's a exam of skills, exam of your smartness. As much as you are a smartest, you have a your pre built in your formats, so you are not going to suffer anywhere, either at communication, either or long clinical consultation. But if you don't have formats, then you will be in trouble in many aspects, because you have to fulfill the criteria of skills. We will discuss how to prepare our long clinical consultation card outside, and how to deal with the long clinical consultation. I'm going to share with you a slide which will help us in build up our format of long clinical consultation, how we can use our 15 minutes time, and how we can move all these 15 minutes, how we can finish each and every task, because few tasks are very hidden tasks, especially welfare. you know Welfare is a hidden task which we are ignoring most of the time. Clinical judgment, we don't know, and differential diagnosis, we are suffering with the we are you know we have a lot of problem in putting the differential diagnosis in front of the examiner, especially a sensible differential diagnosis, regarding that topic. But the time comes when the on the differential diagnosis, we are shaky. We always, we don't have a time. We don't have a sensible differential diagnosis. So we will discuss because this is separate skill in the room. So you need to be very fluent in your introduction. Introduction is fixed. Let me tell you one thing, Dr. Ali. So whatever the symptom, whatever the case, whatever the scenario is there, this format will remain the same. Only a single point, which is a variable point, voice distortion from my side. Doctor, my voice is clear or not?
It's clear, doctor.
Okay, thank you. So if you understand this chart, this slide, then it's introduction, agenda, sympathy, empathy, past medical and drug history, OD-para, and WEFers. We will discuss the general questions, the impact on the job and social life, and the personal history and examination. So if you think generally, then only the one area is there, which is a variable. Otherwise, any symptom, if we discuss, if we have in our exam, this format will remain the same. Introduction is the same, agenda is the same. We are here to discuss with your health condition, sympathy, empathy. These are the fixed words. Past medical history and drug history. You need to ask each and every surrogate: do you have any diagnosed medical illness? Are you currently taking any medicine? Then coming to the OD-para, whatever the symptom is there, you need to do the OD-para: onset, duration, progression, and aggravating relieving factor and association. So this association, OD-para, the last is very important. This is a different approach. Otherwise, all other approaches are same. Dealing with the joint pain, so your locomotor system is the local system now. So you need to ask the first local questions, mean locomotor questions first, then go to the general questions. If you are dealing with the jaundice or you abdominal pain, so GIT is the first system. In this way, if you are dealing with the headache or eye problems, so CNS, you need to ask questions of that particular system. Then you go to associated journals system. Is that particular system complain, we need to ask about the few complication. For example, if the patient is having about anemia and joint pain, and if the patient, any patient presented with the joint pain, you need to ask of the cough and grittiness in the eyes. So these are the complications. We are usually asking, but it's a particularly very important, chronic disease. Then we ask about the wafers. Wafers means, yes, Dr. Sapna.
Your voice is breaking, doctor. It's very difficult to hear you.
Dr. Sapna, do you have any
Yes,
question?
yes, your voice keep breaking. Difficult to hear you.
Ali, Dr. Abdullah, and Dr. Farah.
Yes, doctor. In between, it's breaking, but like sometimes it's like very clear, but sometimes distorted.
I'm really very sorry. My internet signals shows it's good. Okay. Let me share another link to you guys. Maybe some problem with this. Let me try again. Okay.